Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome to Abby Tyler's Healthy Living, our Tuesday show. My name is Abby Tyler. I'm your Healthy Living MP. How are you guys doing? Hope all is well. Please invite others to watch the show. As you can see, my topic there today is 5 important topics to celebrate Women's Health Month. May is Women's Health Month. So it's hard to bring out important topics. There's so many health topics that affect women and all that, but I decided to pick out like 5 really important ones. Okay. So please invite your friends. Please share the show. Please share the show. Welcome to those of you who are watching from Focus in Liberia and also on YouTube. Okay, as I always start every show, I am a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider. Okay, and also don't forget to give me a thumbs up and please like and comment. Please. Okay, so again, I'm going to put my glasses on. Okay, so Women's Health Month was started way back before the Department of Health, and it also celebrates and also bring highlights important issues that affect women and young girls and girls around the world and all that. So it's important. And also, as women, we have whether you're married or not, but you're so busy taking care of yourself, taking care of the family, taking care of you. If you have the sandwich generation, where it's like you have your mother still, your parents still alive, and you have your children and all that too. So you're taking care of all of that in addition to your work, and also we have so many things that we have to do, and most of the times we put our health on the back burner, which can be very dangerous in the long run, because most of the time we tell you have to go follow up with your doctor, you have to get this test done, you have to get this screening done, and you're so busy trying to be everything to everybody, and we usually put our health in the back burner, like I said before, and that can be dangerous. So it's important that we have this topic every year. Every day is Women's Health Month, by the way, awareness and all. But as with every other disease, we pick a month to kind of highlight it. Okay, so let me just go in here, and I will be reading your comments in between. Okay. Alrighty, so let's get started. So why is Women Health Month important? For one thing, this one thing, it saves lives. Okay, so thanks to the awareness campaign of Women Healthcare Month, the holiday equips women with important resources and knowledge, and this can also help combat illness and indeed saves lives. Okay, healthy women, healthy families. Like I said, the good health of women affects the well-being of their families. A happy, healthy mother is more likely to raise happy, healthy children, and health is a human right. Okay, access to affordable health care is a universal human right. Celebrations like Women Healthcare Month ensures that women across every stratum of society have access to good health care. So yeah, again, I'll get to that part when we get to that. Okay, so again, healthy women helping. Again, if you don't have children, it doesn't mean that okay, as you can be healthy if you don't have children, but chances are more than likely, if the mother in the house is eating healthy, exercising, and making sure they're doing everything that she's supposed to be doing, chances are more than likely her children will be healthy too, and the father. Okay. All righty. So, how do we observe women's healthcare? So, let's go through some of the 5 important things. 1 second here. Okay. So, I'm going to change my spot because I think my internet is probably, and if it does that, hold on a second here. Okay. Give me 1 minute. Okay. All right. So if I have any issues with the internet tonight, I would just record this and put this on. Okay. So let me just go in here and making sure everything is correct. I love the interact. I could just record this, but I love the live interaction that I get with people. So if I have any internet issues, just please put a, put that in the comments, okay? Because sometimes I can't see it from here. Okay, so let's start. Gynecological care for women out there, for young girls. You're supposed to be getting your. Let me go here. GYN mean gynecological, and OBGYN meaning you go to the doctor, you go to check out your female parts. Okay. So you want to make sure you're supposed to get in your pap smear, okay, to check for cervical cancer and your HPV screening to get check for cervical cancer. Okay. So you want to make sure you start at age 21. All right. It's only at age 21. You don't do that earlier before. You used to do that before, right? Because when you go there, they have to do the scraping and all. And before that, instead of compromising the cervix is the part that lies right behind the vagina and before you get to the uterus, which is the womb. So you have to make sure that part is, do that. You're supposed to go every 2 to 3 years, 3 to 5 years, depending on what your medical history is, your family history, and all that. So your doctor will tell you what it needs to see you next year, depending on your results and all. So you want to make sure that you get that check so you don't get any kind of, you don't get cancer that spreads into the other part of your body. Okay. So you talk to your doctor. Make sure when you're age 21, you're supposed to continue that up until you're, unless if you have any kind of surgery that remove your cervix and all that. Okay, and also for girls who are younger, they got the Gardasil vaccine and all that can protect you against that virus. So because some of the virus, people get the virus and the body can clear it out normally, but some people that can progress onto cancer. So it's important that you do that. Okay. So also you want to get your mammogram. I did a show on breast cancer awareness, and also the United States Preventative Task Force. I did a video right before this one that just recommended that women start getting their mammogram, routine mammogram at age 40 because they were finding out that most people were getting the mammogram at age 50, and by the time they were diagnosed, they were getting at the later stages. Stages are from 1 to 4, and the earlier is detected, the earlier you can get not cured, but make sure you get the treatment that can stop it from progressing. Okay, so at age 40, you want to start getting that. That also know your family history. So if you had a family, the mother and father, first degree relatives, your mother, your sibling, like a female sibling. Also, you want to check your father's side too. So if they were diagnosed long before age 40, you want to talk to that with your doctor. So you may have to be getting tested earlier. And also you find out from your family, okay, you got diagnosed at this age. When you got diagnosed, what stage did they diagnose you in? Because sometimes when people get diagnosed, it's like so far gone already. So it's important that you also have that information, okay? And I know we come from a culture that we don't like to talk about those things, but those things are very important that you do. Okay. And also, you want to be doing your breast self examination. I did demonstration of that before in my breast cancer awareness video. You can go back and look in there. Okay, so I'm going to just go in here for a second. Okay. Okay, let me see here. And it says women have been getting diagnosed early with breast cancer, no family history. How can you advocate to get tested if your doctor doesn't think this is necessary? Yes, like a 1 in 8 women would get diagnosed with breast cancer, regardless of family history. That's why it's important. Like I said, making sure that that's average risk. Most doctors don't want to do it, but you can still push it every once in a while. Maybe like I don't know, maybe my family member had it, and I'm a little concerned. Especially if you can talk about it with your primary care doctor, and you can also talk about it with your GYN too if it's really concerning, and if you feel any kind of symptoms, is that maybe I feel something, we can always get the mammogram early, or we can do a breast ultrasound too. So in case we still can do breast ultrasound and also progressive mammogram if we need to. Sometimes you can even do the mammogram and progressive ultrasound. Because me, I usually do my mammogram and then I follow with ultrasound too. So there are ways of working around it. Sometimes it could be insurance issues and all. So it's important that you had that conversation. And if you're really nervous and all, you establish care with your doctor, is establish a rapport so your doctor understands, okay, yes. And I don't want to be the person, your provider, if you're talking to me, you're nervous about it, and I say, oh no, you're still young, you don't want to do it. My first mammogram I did in my 30s. Okay, it was negative when I did my testing and all that too, but I was worried about that because I was having other symptoms. So they can still do it early if they feel that they need to, and your doctor can also have that conversation with the insurance company too, because there are times when they'll say no, and I have to get on the phone and say, no, you need to get the provider on the phone. So I'm talking with the insurance company saying, this is what's going on. And I write a really good note. And most of the time they will agree with it too. So that's important that you establish that rapport with your doctor way ahead of time. And if you have those concerns. Okay. And also make sure you're doing your breast examination. Don't say, okay, I don't feel anything. I did a full, demonstration of that. So people do this. No, you're not going to feel anything that way. Okay. So go back to my breast cancer awareness video, do that. And if you're a woman who still sees her period and all that, try to do that at least like a week after. So your hormones and everything's like kind of down and back to normal. Because if you're doing that when you're still in your period or getting back to get on your period, everything's swollen and all, you may not be feeling exactly what you're supposed to be feeling. Okay. Again, learn about your reproductive health and all, making sure you know to have that class when you're in like junior high and high school. Mothers out there, please start explaining it to your children, your daughters about going through puberty. Excuse me. My throat's a little dry today. Allergies. I did do a video on how to talk to your girls about the talk. I'm going to try to pin it on the underneath the comment section if I remember that. Okay. On your healthy sex too, you want to make sure that you have a good relationship with your partner and have a good relationship. If you're younger than that, if you're not married, you want to have that talk because anytime is one time you can get pregnant. Also learning about any rape culture, all the different things out there that come along with unhealthy behaviors. Okay. And also, like I said, your mammogram, get your cervical cancer screening. And if you start feeling with thing with ovarian cancer, it's really hard. There's no way to really check on that until way after the fact. So just if you start feeling any kind of you feeling bloated, you feeling kind of different, you said there's something going on. I'm tired. I'm feeling bloated. I'm feeling, because I tell you, I also told you guys that different symptoms can go for different diseases, but when you talk to your doctor about it and all that, it can kind of rule out, okay, maybe this is not this one, we'll do this test, and maybe this is not this one. Okay. And also again, knowing your family history, already knowing about uterine cancer if you haven't like severe vaginal bleeding. We talked about fibroids before. If you didn't get to see that, we did all that. And also sexually transmitted diseases. If you are not in a monogamous relationship, I'm not here to pass any value judgment on anybody. Even if you're going to be suddenly in a regular monogamous relationship, you want to get tested first. Okay. Both of you go get tested, still do protective sexual intercourse and all that until you get tested. And you might want to do a little test, get tested again at least 3 months later, because you can get infected today. Your partner could be infected today, start a new relationship, and 3 months later or 6 months later down the line, they have it. Okay. So it's not just only HIV, AIDS, also the other sexually transmitted diseases too that can stay with you for a long time. Things like herpes, herpes 2 that can stay with you, herpes 1 and 2 that can stay with you for a long time. So have these conversations normally with your doctor and also with your partner. Okay. So I'm gonna go in here. Banners. Okay. Next one is heart health. Okay, when people talk about heart attack, most of the time too, it's like mainly with men. It's like, okay, your man having that, and women when it comes to your heart and all heart disease and all that in women, like 1 in 4 heart disease is like the number one killer of women. Okay, that's like all the cancers and everything combined. It causes one in every 4 death for women. So it's something we really need to do. If you missed my heart show, I did that too in February. Go back and watch that. No, keep a healthy weight. I'm not saying do the BMI where you have to be here, this and that, because that comes with so many different variables and all. So keep a healthy weight for your body frame is what we're trying to say. Okay. So, your family history also. If your family has like high blood pressure, high cholesterol, heart disease, somebody had a stroke before, anybody had a heart attack, try to know that, especially your first degree relatives. And then also people are like that. If you smoke, try to quit. There's 1-800 quit now. Cut back if you can and quit, cut back severely, but try to quit. Okay, because all of that leads to that too. Smoking affects your blood transfusion, your circulatory system, the blood flowing in your body. Also, if you have to go to surgery, if you're a smoker, it makes it difficult for you to recover when you, especially for anesthesia and all that. It also makes it difficult for your healing and all, especially if you have like a serious surgical wound. It's important that you quit smoking. Also, smoking can put fine lines on your body and all. So you don't want to do that. They said they had a couple of, and they're talking to a group of women one time, and they're saying, "Oh, you're smoking, but guess what? All of that over here for fine lines and make you, it ages you." So women are like, "Oh, I don't want to look old." So of course, but that should not be just the only reason you internally you want to quit smoking. Know your cholesterol level. When you get your blood work done, you know your cholesterol level, ask the doctor. If they say, okay, yes, your blood work was fine, Tell me what's my good cholesterol. Tell me what my bad cholesterol. What was it last year? What was it a year before? And start looking into that. Okay. Your A1C, for those of you, for those who have diabetes and all, you want to, if you're pre-diabetic, if your doctors, oh, my doctor said I'm pre-diabetic. What is the range of numbers? So ask, where's, okay, I'm pre-diabetic. Okay, that means like you have higher chance of becoming diabetic. Okay, so ask your numbers. What can I do to get those numbers down? How, how close I am to being diabetic that I'm going to need medication. And if they tell you you need medication, and it's a, we don't just give medications, we also tell you to make sure you eat healthy. And sometimes we may have to just repeat the numbers, because you can eat healthy and exercise and bring it back down. But if you're diagnosed when the numbers are really high, okay, and they say, okay, this is pre-diabetic, this is diabetic, and your numbers are really high when you're diagnosed the first time, you may have to go on medication the first time. And please do not say and say, oh no, all they want to do is give me medication. No, you have to go on medication. All right. And then also you're eating healthy and exercising, watching your stress level. And that can also help with the fact that you don't need to you don't need to take that many medication after all. Okay, that's the good thing about type 2 diabetes. You don't, you can completely, sit there and say, I don't have to take this medication anymore because my numbers are much better. Or you can lessen the amount of medications that you're taking, because we can lower the dosage. And then eventually with type 1 diabetes, that's something you have to take insulin forever. If you miss my diabetes show, please go back and watch that. I brought some really good shows. Okay, watch your healthy weight. Like I said, know your kidney numbers also, because that also affects how your diabetes is going to be treated. And the kidneys don't hurt. Okay, the kidneys don't hurt, and most of the time you don't know that something's wrong with your kidneys until it's way far gone into it. So make sure you ask into, what are my kidney numbers? What does it look like? Am I, stage one, stage, So I need to know that. So ask them. Am I stage one and stage two? Usually you don't have any symptoms and all. When you start getting to stage three and stage four, that's when you don't want to get to stage five, because and that's when you're going to have to end up with dialysis, depending on everything else that's going on. So if they tell you these are your numbers, we want you to see the kidney doctors and start working on that, because you cannot reverse those numbers, but you can keep them from getting progressively worse. Okay. So let's get into that. And number, I don't see any other questions there. And I hope I'm on. Okay. If I'm still on, please can somebody just comment, yes, I'm on, you're on. Alrighty. So third one is mental health. Let me move my thing over here. May is also mental health month. We did a show on mental health. I've done a couple of different shows, and that put that on also. Okay, so May is mental health month, making sure you're taking care of your mental health as women. Again, like I said, we worry about everything. I'm one of those people who worry a lot. You worry about your job, you worry about your kids, you pray that everything goes well. And there's so much that goes on in this world right now that you wake up in the morning, you watch the news. I put the news on so I can wake up. Okay. But then it's like the first 15 minutes of the news is like, oh my God. So I don't even put it on. I just kind of put something on that I was watching on YouTube, and I get myself ready in the morning. So making sure you're taking care of your mental health. If you're having anxiety issues, some people have anxiety disorder. So you already have that diagnosis. It's not just something where you're just anxious about, but something over time. Your doctor, speak to your doctor about that, and making sure if they put you on a medication, and they'll tell you also go to see a therapist too, because it's not just a medication. You also want to be talking to a therapist also. I know the fact that it can be expensive, and I know it's not always readily available in certain areas, but if you need to get the help, get the help. Depression, if you're thinking about suicide and all that, the suicide number 980. If you have a family member that needs help, yes, you can pray for them. Yes, you can do all the many things you want to do, but they still need help. Okay, because if they had a headache or their knee was hurting or whatever else, you're not just going to sit there and say, let's just spray over it, or let's just do this. You would take them to get their help, especially when you see that it's affecting the work. And you as yourself, if you see it's affecting your work, call and get the help that you need. Okay. And in the meantime, like I said, we're going to be putting the medication, because most of the time my patients come to see me and they haven't seen a therapist yet. I'm going over everything that's going on with them, asking them about different things, but you still need to see a therapist because that's their specialty. All right. So, and if they put you in a medication, and there's some people who have, like, again, like I said, they do have mental health diagnosis and all. So different thing like bipolar, schizophrenia, all those different things can be managed on the with medication. You can live a productive life on those things. So, and people who are taking care of you, your doctors, your lawyers, your politicians, they have those issues too. So don't think people are just walking around and it's only people who you thinking that shooting up the place and doing this and doing that. No, as just part of life. You have this, you take your medicine and you go to therapy if you need to and live your life and have a productive life. So it's not a curse. It's not something that somebody did to you. I know in certain cultures, people see that. Please work around that, okay? Because in order for you to live a productive life, you have to get the help. The same way if you had a stomach ache, you're not just going to sit home and pray and pretend that that's not going on, okay? So let me just go in here. Yes. Oh, thank you. I wasn't sure. Okay. So making sure, and also there's some good people out there who some people might want to go to a therapist that look like them, that relate to the culture. You can call your insurance company, and most of the time, so you can see, you can look online and look at people have their pictures online. You see where they work, you see the places, and you can see, because I know people might say, "Oh, why do I have to go to somebody who looks like me?" But sometimes you want that shared experience, okay? Because if I'm sitting there talking about something that is relating to, how Liberian culture, and this person doesn't understand that, I mean, we may not have a good relationship, but if that person is willing to learn, that person's trained to teach and to also treat other cultures too. So if you're getting the vibe that that person is not respecting your culture enough to understand where it is you're coming from, then of course you have to say, okay, I need to get somebody else. But make sure, it's not always possible to get somebody who looks like you when it comes to that, understands your culture. But again, once that person is willing to learn and you get that vibe that yes, this person understands what I'm going through and they can understand that. Yeah, it's similar. Like I said, if you go to a dietitian that says, "Oh, don't eat any rice, don't eat this," and you eat rice as a staple, that's not going to work. Okay, but the person can say, "Yes, you can eat your rice, but this is the way you can make your rice healthy." Like I always tell people too, if you're eating, I people always thought, "Oh yeah, you're talking against Liberian food, you're talking about your African food," and no, I say there's a way, especially as you start getting older. But you should do that when you're younger. But when you start getting older, you can't just sit there and eat heavy food late at night anymore, because your body's not burning the calories as quickly as they did when you were in your 20s. Okay. And especially if you're not working, you're not going up and exercising and all, and then sometimes like you just gain weight doing due to hormones and all of that too. So all of that comes into play when it comes to women. I mean, look at what's her name, Martha Stewart. She's on, what's the magazine, is it Sports Sims Illustrated or something? Sports Illustrated, and she's, I think it's 81. I'm like, oh, go on, Miss Martha, look at you, because people also talk about the fact that, oh my God, I went to see Janet Jackson concert and she's not moving the way she used to, and I saw this person, and there's other people in the comments and saying, wait a second, you think she's going to be moving the same way she was moving when she was in her 20s? Are you moving the same way when you were in your 20s? Okay, age happens, life happens. You're not going to be able to move there. There's some people who still have the same stamina. That's fine with them, but it's not that's the exception. That's not the rule. So especially women, as we start getting older, we start feeling bad about, oh my God, I wish I looked like this anymore. I wish I could do this anymore. And it's like, age happens. Okay. I wish sometimes I used to be like dance forever and all. I dance. I love going out to parties and hanging out and dancing. I hate people who just sit around. It's like, why come out? Anyways, but there's certain things you can do, and you have to accept that as you're growing or as you're aging, especially women who live in a society where everything is visual, where you have to have the best picture on Facebook or Instagram or TikTok and all that too, and this, and everybody's doing this and everybody's doing that, and you start feeling bad about yourself. That's just the picture. That's what you see on Facebook. Social media is what they want you to see. You don't see the everyday life. You don't see everything else they're going through. You don't know what that person's going through, all of that. And not putting all of that on social media. So give yourself some grace. Okay. Yeah. Like I said, I have a friend who gives me backhanded compliments, when she told me, oh, you always teaching about healthcare, but you're getting fat. Oh my God. You always say we should eat healthy, but you're getting fat. Thanks. Thanks for telling me I'm teaching my healthcare. And I always tell people, I don't come on here to shame anybody, to say, you're supposed to look this way, you're supposed to look this way, and all that. I'm a woman of a certain age. I will gain weight. I'm a woman of a certain age. My hormonal and changes will come into place and all that. I still exercise as much as I have to, and I still try to eat healthy as much as but I'm not going to be the same person that I was when I was in my 20s. And I'm not going to sit there. Some days when I'm like, oh yeah, I was real skinny back then and all. But it is what it is. I'm doing my best and I'm watching my lab numbers. The most important thing is watching your lab numbers. Okay. So don't let people make you feel bad. She did make me feel bad because I'm like, she came at me this way and then it was like, you know, just like that. So people, and second time, people who know me on my personal page, I just kind of, the next time I saw her, I just kind of, it was just coming and I just slipped away, because you have to be ready for things like that. And sometimes you just have to, walk away or say something. I know somebody said, when somebody says something really nasty to you and you just say, so exactly what do you want me to do with that information you just told me? What is it? And then you would just catch them off guard, but you have to be quick and witty with that, So sorry for my little tangent. My former pastor, he said somebody came up to him and say, oh, the Lord told me to tell you you're fat. He said, the Lord didn't tell you that. You just want to tell me I'm fat. He said, I know I'm fat. Go on. Okay, so people are people. All right, so just watch your stress, watch your mental health, and if you need help, please get help. Okay, and the next one we'll do here will be making sure. Let me go back to my banners here. Making sure that you're following up with your annual visits to your primary care provider. Okay. So again, most of these things that will be found out when you do see your primary care provider. I know most of the time people in their 20s and 30s, they don't usually go to their primary care providers, because usually just the times when you're very healthy and you're like, I don't need to go. I'm paying my health insurance and all. And you paying health insurance year after year after year. You're not going. Sometimes they only go because they get pregnant, or most of the men, forget it, they won't go unless something starts happening. So it's important that you go see your primary care doctor, because they're the first line, and everything. You want to be getting your yearly labs, like I said, checking your blood pressure, checking your blood sugar, know your cholesterol level and all. If you need a referral to see other doctors, your primary care can do that. They do all your physicals. They regulate your medications too, because sometimes you may be taking a medication that's no longer effective, or a medication that needs to be changed, and you've been taking that for a while. Even if it was prescribed by another doctor, every time you come to the doctor's office, we do medication reconciliation and all that. So you want to make sure you follow your your primary care doctor. We're looking at your social history. We're looking at your family history, doing colon cancer screening. They'll send you for your colon cancer screening at age 45. Make sure if you have family members of it, with history of that, talking to them and see if you can get it earlier, because if they were diagnosed, that means they say you should get it 10 years prior to when they were diagnosed. Okay, I did a show on colon cancer screening also. Go back and watch that. You'll be getting your vaccines, especially when you're age 50. You want to be getting your shingles vaccine. You want to be getting all the necessary vaccines that pertain to your age group. For women who are older, you'll be getting osteoporosis, making sure your bones are not brittle, especially when you're a thin woman, that you're not going to break anything. Also, if you're heavier, if you fall, you could break something too. So that's also important. You want to make sure you're getting your all the different vitamins and all. So your doctor will be able to explain all that to you. We can some primary care doctor, you have your OBG, what they do, we do OBG, we're trained to do OBGYN stuff and all that too. GYN part, not the OB part. We can do the pregnancy, but we usually send you to a specialist, but we can do pap smears and all that in the office. And also for the young girls, like again, like I said, we can talk to the young girls, when they get to like maybe 12 or 13, they don't want to go to the pediatrician. When they come to us, we can talk about everything that they, pertain to women reproductive systems. And also women who are menopause, that's the cessation of your menstrual period. That's something people don't talk about that much, because it's like taboo for somebody to say when it's in menopause. And that means, oh my God, you're not young anymore. You're not young and vibrant anymore because you're not seeing your period. That means you're old, and your husband or your lover is going to leave you for a younger person who's much fresh, and this and that. All this old thing you hear about menopause back in the day, and it's like a curse. People looked at it as a curse, upon women and all. Guess what? None of that is true. Okay. But there are a lot of things that come along with menopause also, that affects your physical health, that affects your heart health and all. So it's important that you have these conversations with your doctor. Okay. When you start going to menopause, when you hit menopause, is when you haven't seen your period for 12 consecutive months. So if you're still not seeing your period in between and having a couple of months later, and or you're still like, you're more like perimenopausal. And some people can go through menopause from age 40 all the way up to like 55. Okay. So it's important that you start talking to your doctor when you start having these changes. They can put you on some medications too, to kind of help with the hot flashes, to help with the anxiety, the insomnia. That means you're not sleeping enough. That all the things that come along with menopause, and you can still live a productive life. You see people in the 50s and 40s and 50s and all that. They don't look like they're just ready to hit the floor. Okay, so all of that, and sometimes you may need to talk to other people too. Also, the therapist, so you may not want to. There are other things that come along with it. So it's important that you do talk to, you have these conversations normally, because when you come to see a primary care doctor, we start having those conversations long before that. Okay, as you start aging, we'll be like, okay, what are you doing for this one? What are you doing for this one? This is what is supposed to be expected. So make sure you have a good primary care provider and you go to them when you see them. Make sure you're having these conversations as you age. Okay, and for girls also, like I said, you see their pediatrician when they're growing, getting to certain ages, making sure the pediatrician is checking to make sure that they're going through puberty the right way. I know some people don't like to see their little girls going through puberty and oh my God, and she's this and that. That's a natural, that is the natural way of life. Okay, they're going to go through a little girl stage and they're going to go through their period. So you want to discuss that, because also a lot of girls, they have a like really bad cramps, and some have nausea and vomiting and severe headaches that come along with seeing their periods. Those are conversations that should be you be having with your daughters, okay, or the young girls in your life. All right, or speaking to the doctors also. I get, like I said, I did a show on expecting the talk, or how to do the talk. It's in one of my videos down there. You can go there and take a look and have that conversation with your daughters. You should be having that conversation at least by age 8. Okay, some people may have it a little earlier, but by age 8, because girls start going through puberty between 8 to 9. Okay, so make sure anything earlier than that, that's precocious puberty, and you want to bring that to your doctor's attention. Okay. So making sure you have that conversation. All right. So women's health starts with young girls all the way up to age 99, 100. Okay, because of course people have problems then too. Alrighty, and number 5, the most important one there. There's so many other things, but I chose to do this one. Is, be an advocate for yourself and other girls and women in your neighborhood and in your state and around the world and all. Okay, making sure that the people you're voting for take women's health very seriously. Okay, you may have certain beliefs on, okay, yeah, this is this and all, and I don't believe in women should be doing this, and I should believe in, what is it, the controversial ones, or like, abortions or anything else. Making sure also, the people who your local politicians do, you want to talk, you want to make sure that they're having, especially some girls don't have like pads and all, sanitary pads in America. People can't afford it that much. Okay, because it's something you have to use every month. Not everybody can afford it. So if you can donate to a school where they can have enough supplies in the bathroom for some girls who don't have it, making sure that you have there's a nurse in the school, or 1 or 2 nurses in the school district, because right now most schools are kind of cutting back on the nurses. You don't yeah you If the girl's having problem, you want to make sure that she can go to the nurse and talk to them about it. Okay, because nobody wants to be sitting there be talking to a guidance counselor. I'm not saying guidance counselor can do it, but yeah, who wants to talk to the guidance counselor, especially if your guidance counselor is a man? Okay, so no hate. I don't need my, commenting on something, stuff in there. So, but also, talk about, know what's going on around the world, women around the world. There are a lot of things that cause the traditions. Most of these traditions, oh yeah, this tradition and tradition. Most of these traditions around the world are always against women. You notice that. Okay, so talk about, also learn about domestic violence. If you know somebody who's in a domestic violence relationship, make sure that you're giving them the help that they need, or directing them to the help that they need. I did a show on domestic violence also. Women who have postpartum depression, try to vote for people who would say, okay, yes, we want paid leave. Why can't women have paid leave when they have, their babies and all that? Because most of the time you're like, oh my God, I got to hurry up and go back. I got to hurry up and go back. And you have to breastfeed, making sure they provide breastfeeding, clean breastfeeding places in the mall and at your job and all the places. I remember when I was breastfeeding my son, and one time I had to help one of the doctors with some surgical procedure at the bedside, and I couldn't leave. I was like, okay, I can't. And I'm sitting there going, oh Lord, please help me. There's nothing should be, when I was a nurse, there should be nothing, on my blouse right now, because, so ask for that. Do a lot of things that mentor. If you can mentor these young girls also. Okay. They need really good, positive role models. I'm not saying you should go in there and try to be, somebody from the 1950s. Again, no hate, but try to mentor these girls, because a lot of girls out there, especially women in your own family, if you can, you don't have to do anything grandiose. You don't have to go out there and save the world, because of some people on Facebook, they think that because they go across the ocean, or they're doing this, so they're doing something more. You can do that right in your backyard. You can go to the school and ask, what do they need? What do you need? What do the girls need in the school here? How can I help? You don't say, okay, I can do this, I will do this. The little way you can help. Okay, because most of these girls, they have the big sister, big brother program. I used to be a big sister to a young girl. Okay, you can do that. You can help out the Girl Scout. You can help out your church group. There's so many things. Okay, advocate and make sure you're voting for people who understand, how women work, young girls, and laws that protect women. Okay, domestic violence, again, like I said, gun violence, all those different things. And all those are like things that affect us every day. Okay, pray if you can pray, but making sure you go out there and advocate for yourself. And also in the business of healthcare, when you go to your doctor's office, making sure you speak up for yourself. It shouldn't it may come across like, oh my God, this person gonna be a problem patient and all. Like I always say, don't go in there and be all aggressive and all. Just making sure, say, oh no, this is, I some people come in and say, oh my God, I have all this stuff and I have this whole packet and I read it on Google. Like again, like I said, well, I told you, yes, Google is general information, but I want you to come in here and we can sit there and talk about it. This thing that pertains only to you. Okay. So please, 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 again, like I said, get your GYN exam every year or according to when your doctor wants you to come in, your mammogram, everything, your self-breast examination, check care of your heart health, your heart health, know your blood pressure, keep a healthy weight. If you smoke, quit smoking, walk a lot. Okay. Sitting is a new smoking. So you want to make sure you're always in motion. And of course, you could get tired, but make sure you stay in motion and all that. Know your kidney numbers, know your blood sugar numbers and all. Take care of your mental health. Find something that makes you happy. Okay, where you can just release your stress. When I come home at night when I'm charting, I sit there and I watch the Golden Girls, or I watch Three's Company, or I watch, I was like, oh, Will and Grace, all those little reruns, or I just put something on YouTube, I'm watching and I'm listening to that, or I'm watching something on Facebook, some video on Facebook and all that. So I hope I didn't want to go too long. So, but I hope this has helped. Please give me a thumbs up. Please give me a thumbs up. Comment, share the show. And if there's anything else in the summertime now, I know people will be outside. So there will be days where I'm going to take this show and put it on. I'm sorry for the technical difficulty earlier. But I love the live interaction. Okay. So I wish you all the best of luck already. And I know I look a little professional today. My job now is like I don't have to wear a uniform, but I choose to wear it. And so I have the scrubs on and then I have my lab coat on. So it's so much easier. Can't believe like many days I had to wear a uniform and now I'm like, okay, I'll just put it right back on. So, but thank you all for watching. I really appreciate it. For all of you who are watching on Focus on Liberia on YouTube, thank you for watching. And please give me a thumbs up. Please invite others to join the show. Just send a big, long invite to all your friends so all of them can just join because I'm still trying to get to at least 2,000 by July. Okay. And thank you all for watching. I pray the best for all of you and your family. And I will see you guys next Tuesday. Okay. Take care now and good luck. Bye bye.